been introduced here by the RD. Indeed, if it was not for your willingness to come and help, to respond to our president's call for send me, which is said in our language here, Tumamena, we would not be here. So indeed, we are grateful that you are willing to be tumat. And that's why we are here today. We want to thank our minister for taking the initiative to engage with Director General Dr. Tedros to request assistance in this fight against the invisible enemy. And indeed, very grateful that Dr. Tedros and the RD and their team responded very speedily. I must say, when we had the virtual meeting the other time, a couple of weeks ago, I didn't expect such a speedy response. I thought the bigger the organization, the slower the movement. And being such a big organization, I thought, but you have proven me wrong, that you're able to move with so much speed. Indeed, we thank you for your leadership at the world and also at the continental level for leading this fight against this invisible enemy, and indeed for your very prompt response. We appreciate this assistance. We, as already been emphasized by all the speakers, we are indeed all learning how to manage this invisible enemy. But we are cognizant of the fact that at the world body and also with the regional office in Brazzaville, you are in a vantage position, better placed than us. We also, learning all the time, but we believe that yourself, the world sitting there in Geneva and Brazzaville and all over the world, you are at the vantage point to get a fair assessment of various experiences with the reports which you get from your country offices, regional offices. You are better placed, to can synthesize all the information, lessons, experiences, as you regularly also update the world. That by sending this team here, we will be in a better position to can benefit from that experience and be able to plan better. So we're looking forward to the guidance, as we have been saying in some of our meetings here with President Ramaphosa, saying that as we deal with this pandemic, we are in a situation where it's like crossing the Zambezi or crossing the Limpopo, and you cross by feeling the stones. But in this case, we will not have to feel all the stones, because the team here, which has got an advantage of accumulating various knowledge and information and experience, will be able to tell us that don't go this way, because there's going to be very sharp stones if you proceed in this direction, because indeed there are a lot of unknowns at this stage, but we are quite confident that with the kind of expertise you have added to our fight, we will be able to cross this river at a faster pace and with a lot more lives being saved. Indeed, COVID-19 has brought a lot of new ways of doing things, as we are doing even here today. And this just reminds me of the fact that I'm not sure if you look into the history of the WHO, there should be very few situations where the World Health Assembly hasn't sat. And the fact that in May this year, we had to go through a virtual World Health Assembly. And in a few days, 10 days, just over 10 days from now, we also will be going through a virtual WHO Afro Summit. So this is just a reminder that also as the health, as the nations of the world in the health sphere, we are also highly affected. But we believe that this indeed will pass. So just adding to Minister Mkhize to say, indeed, we want to say to you, the team, indeed, you are very much welcome. We're looking forward to interacting with yourselves, with the leadership of our DG here, and the rest of the national team and the various structures which have been set up across the country. We're indeed very confident that as South Africans, we are going to benefit from your presence. So indeed, in my language, which Dr. Moeti will understand very well, we say, "Realamugela, realamugela, siyanamugela ngesizulu, kaSotho realamugela, so liamugetse, bagaetsho. Welcome to Mzansi, Africa. Thank you."
Thank you very much, Mhlonishwa Tau. Once more, thank you to Dr. Owen Kalua, who is able to pick up my calls at 10 o'clock at night, very late, to try and pull this together. The team that prepared, Sislebu, who's head of our international health liaison, Dr. Neluheni, Dr. Anpan, Dr. Patrick, and all of them. And we will be working with the team quite closely. And thank you again to the members of the media for joining us, our other colleagues, the Office of the President, and of course, under the leadership of Dr. Mkhize, we are led in the department. We now adjourn our meeting. Thank you very much. That's it.